Schizophrenia is recognized to be one of the most disruptive neuropsychiatric disorders and affects approximately 1% of people in the world. Cognitive impairments include working memory, speed of processing, auditory verbal hallucinations, and delusions of control. One treatment used to aid in schizophrenic cognitive deficits is the transcranial direct current stimulation, also known as TDCS. TDCS is a safe, non-invasive and well-tolerated neurostimulation technique. TDCS applies weak electrical current to the brain surface by battery-operated electrical stimulation. Physiological explanations have been identified through some schizophrenia cognitive deficits, such as working memory impairment and auditory verbal hallucinations. Working memory deficits are related to abnormal functioning of the posterior parietal cortex and the ventrolateral prefrontal cortex. Dopamine and GABA abnormalities have also been associated with working memory dysfunction. Relationships have been found between auditory verbal hallucinations and both the left inferior frontal and right postcentral gyri reductions. The physiological effects of TDCS alters cortical excitability through the application of a weak electrical current placed on the scalp via anode and cathode, which results in either increasing or reducing neuronal activity. The level of increasing or reducing neuronal activity is dependent on current intensity, electrode placement, and duration of stimulation. After effects of TDCS can involve plasticity of the glutamatergic system and changes in NMDA and GABA receptor activity. TDCS has demonstrated being an effective treatment in decreasing the severity of auditory verbal hallucinations, improving self-recognition, and modulating the functional connectivity of the left temporoparietal junction, also referred as TPJ, in patients with schizophrenia. This was achieved with placing the cathode over the left TPJ and the anode placed over the left dorsolateral prefrontal cortex. A study by Brun Lin used this TDCS application with patients across 10 20-minute sessions using 2 milliamp over 5 consecutive days. The results of this study found a correlation between the decrease in the severity of hallucinations and the decrease of functional connectivity between the left TPJ and the left insula. This suggests that TDCS may lead to clinical improvement and has been proposed as a treatment for treatment-resistant auditory verbal hallucinations and negative symptoms in schizophrenia patients. Working memory impairment is associated with reduced dorsolateral prefrontal cortex activation and altered dorsolateral prefrontal cortex hippocampus connectivity and seems to be specific for schizophrenia. In Papazova et al. Study, it was observed that a single online TDCS session applied to the left dorsolateral prefrontal cortex during task execution facilitated working memory in schizophrenia patients. Positive effects were observed even after 9 months in healthy controls and after 6 weeks in schizophrenia patients, but there were no direct comparisons of the add-on impacts of TDCS. These results compared to other studies suggest that the consolidation period during 1 milliamp may be slightly shorter than during 2 milliamp. The results of the Papazova et al. Study suggested that the consolidation period during 1 milliamp may be marginally briefer than during 2 milliamp. These findings highlight the need for additional research on the specific parameters of TDCS when considering a long-term treatment on working memory for schizophrenic patients and the milliamps used.